Chapter 1. Recognizing the signs body changes, missed periods, nausea, fatigue, breast tenderness. Emotional reactions, fear, confusion, hope. Step-by-step guide on taking pregnancy tests and interpreting results. Scenario: a girl noticing symptoms and debating whether to test. Educational commentary on early detection and why timing matters. Recognizing the signs, it begins with small, subtle changes, missed periods, unusual fatigue, or a persistent queasiness in the morning. For many young women, these signs may initially seem like minor disruptions in their daily routines, easily dismissed as stress, a change in diet, or irregular sleep. Yet, these seemingly insignificant changes can sometimes be the body's earliest signals of pregnancy. Recognizing them is the first step in taking control of one's health and future. For Maya, a 17-year-old high school student, it started with fatigue she could not explain. She struggled to focus in class, finding her eyelids heavy and her concentration slipping. Her friends noticed her irritability, which was unusual for someone usually so cheerful and engaged. At first, she chalked it up to studying late for exams or skipping breakfast. But when her period did not arrive as expected, a gnawing worry began to take root in her mind. She felt a mixture of fear, curiosity, and denial. Could it really be? She whispered to herself, unsure if she wanted the answer or not. Emotional reactions in these early stages vary greatly. Some girls feel immediate fear or panic, worrying about the consequences for school, family, and social life. Others may feel an unanticipated sense of excitement or hope, imagining the possibilities of motherhood. It is essential to recognize that all these feelings are valid. The emotional turbulence at this stage is normal. What matters is finding constructive ways to process it. Ignoring or suppressing emotions can lead to unnecessary stress, which is not only mentally draining but can also affect physical health. The first step toward clarity is confirming whether pregnancy has indeed occurred. Home pregnancy tests are accessible, confidential, and generally reliable when used correctly. Maya purchased a test from a local pharmacy, feeling nervous and guilty all at once. Instructions on these tests emphasize timing. Testing is most accurate after a missed period, ideally first thing in the morning when hormone levels are highest in urine. She carefully followed each step, placing the sample on the strip and waiting with bated breath. The moment the result appeared, a surge of conflicting emotions washed over her: fear, disbelief, and a curious sense of inevitability. Home tests, while highly reliable, are not infallible. False negatives can occur if testing is done too early, if instructions are not followed correctly, or if certain medications interfere with hormone detection. For definitive confirmation, visiting a healthcare professional is recommended. Blood tests, conducted in clinics or hospitals, are more sensitive and can detect pregnancy earlier than urine tests. Maya, unsure of what to do next, confided in her older sister, who offered reassurance and accompanied her to a local clinic. This step, though intimidating, marked the beginning of proactive care and responsible decision-making. During the consultation, the nurse or doctor typically explains the biology of early pregnancy, the fertilized egg implants in the uterus, releasing hormones that trigger the changes Maya had been noticing. They discuss the importance of early prenatal care, including folic acid supplements, which can significantly reduce the risk of certain birth defects. They may also explain warning signs that require immediate attention, such as severe cramping, bleeding, or dizziness. For Maya, understanding the physiological changes behind her symptoms transformed some of her fear into curiosity and empowered her to take practical steps forward. At this stage, it is crucial to build awareness of emotional health. Hormonal changes in early pregnancy can intensify mood swings, anxiety, and emotional sensitivity. Engaging in healthy coping mechanisms such as journaling, talking with trusted friends or family, meditation, or professional counseling can provide a sense of stability. For Maya, writing down her thoughts and feelings helped her untangle conflicting emotions. She found that sharing her concerns with her sister reduced her anxiety and offered perspective, reinforcing the idea that support networks are vital from the very beginning. Maya also learned about the importance of self-care during these early weeks. Sleep, balanced nutrition, and gentle physical activity can significantly influence both her well-being and the developing embryo. At this stage, caffeine intake should be monitored, alcohol completely avoided, and smoking strictly prohibited. Even everyday medications require scrutiny. Consulting a healthcare provider before taking any drug, including over-the-counter painkillers, ensures the safety of both mother and child. It is common for girls to experience guilt, shame, or fear about disclosing a potential pregnancy. Societal stigma, peer judgment, or concerns about disappointing family members can exacerbate stress. Educationally, it is important to normalize these fears while emphasizing constructive steps. Trusted adults, mentors, or school counselors can provide confidential guidance and practical advice. Maya, for example, found that speaking with a school counselor gave her clarity about her options, support for managing academic responsibilities, and reassurance that she was not alone in navigating this experience. Understanding the early signs of pregnancy also includes recognizing situations that increase the likelihood of complications. For instance, irregular menstrual cycles, pre-existing health conditions, or certain lifestyle factors can influence the early course of pregnancy. Educational resources, either through healthcare providers or reputable online sources, help girls make informed decisions. For Maya, learning about her family medical history and potential risks allowed her to ask focused questions during her clinic visits, ensuring she was actively involved in her care plan. By the end of the first stage, Maya felt a mix of nervousness and cautious optimism. She had identified the physical signs of pregnancy, confirmed the condition through a reliable test, and sought professional guidance. She had also begun addressing her emotional well-being and building a support system, laying the foundation for the next steps of her journey. These early actions, recognizing signs, seeking confirmation, and initiating medical care, are critical. They transform fear and uncertainty into proactive, responsible behavior that protects both the mother and the developing child. Early recognition and care also have long-term educational benefits. Girls who understand the importance of prenatal health, emotional resilience, and support networks are better prepared to continue their education, maintain social connections, and make informed decisions about the future. Maya's proactive approach ensured that she was not passively reacting to circumstances, but actively shaping the path ahead. Educationally, this chapter underscores a key message. Awareness and early action are the first steps toward a healthy, empowered, and informed pregnancy experience. In conclusion, recognizing the early signs of pregnancy is not only about noticing physical changes, but also about understanding emotional reactions, seeking confirmation, and initiating care. By combining awareness, professional guidance, emotional support, and self-care, young women like Maya can navigate the initial stages of pregnancy with confidence and knowledge. This foundational chapter sets the stage for subsequent steps, including ongoing medical care, lifestyle adjustments, and informed decision-making, which will be explored in detail in the following chapters. Key educational takeaways from Chapter 1. 1. Recognize early physical signs of pregnancy, missed periods, fatigue, nausea. 2. Acknowledge emotional responses and seek support. 3. Confirm pregnancy with reliable tests and professional guidance. 4. Begin early prenatal care, vitamins, nutrition, lifestyle changes. 5. Understand the importance of emotional well-being and healthy coping strategies. 6. Build a support network for ongoing guidance and reassurance.